All right. Well, good afternoon, everybody, and welcome to the Making the Shift NP panel discussion. I am Katy Voglar, nurse practitioner and host of the Making the Shift podcast series. And I'm really excited to be here today with three of my Making the Shift guests as we really just dive deeper into the topic of starting out in your first job and in your career as a nurse practitioner. So I want to thank you all for being here today. And after our panel discussion, there will be some time for question and answers. So please keep track of any questions that you have as the panel is discussing. You can also use the Q&A chat box at the bottom of your sort of Zoom toolbar to submit any questions that you have, and we'll be monitoring that Q&A chat box. To start off with, panelists, I would really love for you to introduce yourselves. First, tell us who you are, your name, what kind of nurse practitioner you are, where you currently work, and how long you've been out of school.
Great.
Awesome. Sorry. Go ahead, sir.
My name is Morgan Hastings. I'm a family nurse practitioner. I currently live in Houston, Texas. I work for a concierge service where we provide health and wellness services in people's homes and businesses. I have been a nurse practitioner for a little over a year now, almost a year and a half, and I graduated from Baylor.
Hey guys, excited to be here. My name's Anna. I am a family nurse practitioner as well. And I currently work at Watermark Urgent Care, which is a nonprofit urgent care in Dallas, Texas. And what was the other question? Oh, how long have I been out of school? Let's see, since December 2021. So I've been practicing I started my first job in August of September 2022. For September, so a little over a year now.
Hi everyone, my name is Tegan. I am a nurse practitioner in Sioux Falls, South Dakota. I currently work in the emergency department. I have been in the emergency department and out of school for 2.5, almost 3 years now. And I went through the University of Cincinnati, Ohio for my master's in family nursing.
Wonderful. So let's start off our discussion with an easy question. What is the one thing that you cannot live without during a clinical shift?
I think I'm first. Well, for me, for sure, it's always coffee. I always start with coffee as I have my cup of coffee right now. Coffee for sure is one. I always have my Stanley water bottle and snacks. I feel like if I I can do good on a shift if I am fully fed and everything. So I definitely have snacks, something to drink. That's for sure something I always have.
Yeah, I think that my go-to is been, especially more recently, my apps on my iPad. It's not feasible for me when I'm on the go to carry all the textbooks that I had in my clinic that I was working in prior. And so it's just a really great resource for me to use. I love use Hippocrates. Hippocrates is great. You check for your dosage for medications, medication interactions. I prescribe a lot of supplements for my patients. So there's actually a way you can check the interactions between the supplements and their medications to make sure it's safe to give to them. I love GoodRx, so we're talking about medications. How can I make it affordable for them? And I use FP Notebook quite often just to keep up with the latest guidelines. So it's pretty nifty. It's just palm of my hand. I have all this different technology and wealth of knowledge for my patients.
I think I'm gonna need that list from you, Morgan. But no, I'm with Tegan. Snacks and caffeine. I cannot live without on my shift. And then to add to your list of apps that you should all be writing down, is the EMRA antibiotic app, or any of really emergency medicine residency association. That's what EMRA is. Any of their products. I recently got their, they have little booklets as well. So I recently got one for their urgent care practice. And so I find all of those super helpful.
Really good things to have. I'm with you, Tegan, on caffeine. I have to be caffeinated. I think that's the nurse in all of us. If we could have caffeine IVs, we would do it. So, all right. Well, we're talking about this transition from RN to NP, and that was kind of the focus of making the shift, is really to help nurse practitioners either at the end of school or the beginning of their career to really go through this transition of nurse to nurse practitioner. And I would love for y'all to answer just why you think that transition might be challenging. And when do you feel like you actually made the shift in your brain of I'm a nurse to I'm a nurse practitioner?
Yeah, I think it's really challenging when you're first starting out. I was a registered nurse, a critical care nurse for 5 years before I stepped into the official role of nurse practitioner. And I think it's a lot of information that we're having to consume during that time period. And it's almost like an imposter syndrome. You get like this water hose full of knowledge. You try to absorb as much as you can, be a little sponge. You go and you take your boards and you sit down, you take it and you pass, and you're like, okay, I did it. I've gain, somewhat knowledge, and then you go in and it's a little bit daunting to kind of play that now independent role in a patient's care. So I think that that is something that I struggled with probably at least the first 6 months of my practice, realizing I'm not a student anymore. I'm the actual provider. There was some challenges and things that helped me working in my first clinic, just because I basically did all my clinical hours there, that a lot of the patients saw me as the student. And so you're dealing with the, internal imposter syndrome. Then you have to deal with meeting patients' expectations of now you've like graduated, you've passed your boards, you're able to step into that role. So I think there are some hurdles, and it's completely normal when you graduate to not feel 100% confident going in, but just take it day by day and know that, you are worthy and you put forth the effort, and it's going to take time, but you can do it.
Yeah, I relate to a lot of that. I think for me, I think the challenge that I see as nurses, we're trained to kind of assess and then take our assessment and what we think the needs are to someone else, and then kind of ask that permission, right, for orders or next steps or interventions, and really making that shift to where we are more autonomously making those decisions is challenging. I would say as an encouragement, I do think since we've been nurses before we stepped into the provider role, we do have a lot more of a foundation than we give ourselves credit for when it comes to what we know, and our nursing instincts to know when patients are needing a higher level of care. But I think definitely making that shift to, hey, we're the ones making the decisions is challenging for sure. I would say, I think I still go back and forth on whether or not I feel like I'm fully in that nurse practitioner mindset. And I think to some degree, like that can also be a superpower as well, just like being okay with asking for help and getting feedback. Medicine, I don't think, should be something that we practice in a silo. And so I think nursing prepares you well for that. But I do think kind of that 6-month mark, yeah, a little bit over halfway through my first year, I was like, oh, I am the one making the decisions. No one's like asking me questions about the decisions I'm making. And it kind of starts to click. But there's still moments.
Yeah, I agree a lot with what you guys are saying. My situation was a little different. So where I worked as a nurse, I transitioned into an NP. So the challenge with that was, I went from being one of the most experienced nurses to being a novice again. And so being vulnerable in front of my peers, in front of my coworkers, and knowing that, I'm going to be a little bit slower. I'm not going to know everything was a challenge itself. But even on top of that, that imposter syndrome, like you mentioned, like that feeling of like, okay, I'm expected to be a doctor now. Like I'm expected to know everything, do everything. And I guess my biggest advice for people when they're in like that new NP role is like when you start your new job, find your little community, find your little colony, because those people who mentor you, you can go to questions to, they understand and know that you're going to be experiencing this feeling. And there's not one person who doesn't experience it. And if you don't, that's probably scary, honestly, because you're supposed to be a little nervous. You're supposed to be a little scared. Like, this is important. You're taking care of people. So When I did my transition, all the providers I already had worked with for a really long time, and they gave me a lot of grace, and they almost treated it as like a residency type situation. So it allowed me to give myself a little relief in the sense of like, okay, I'm not going to go as fast as everybody. I'm not going to know everybody. And they want me to ask questions. So I mean, I would say that 6 month mark is right, but for me, like I even think it took almost up to a year, and not for the mindset shift. I knew the shift started happening, but just that confidence of like, you know what, I'm going to order that CT, or I'm going to order those labs, or this person makes me nervous, and I'm not sure why, but I know we need to do this. So I think that first year is your molding period, and as I said, give yourself grace, form people around you that will support you and kind of be like your mentors, and that will help you get through that challenging, period of time.
Yeah, that's all really good. I once had a mentor tell me that they have talked to a lot of other APPs and felt like it was really 6 years into practice where they felt really comfortable. And that always gave me a ton of comfort. Like, okay, this is a really, really smart PA. And he's telling me it's 6 years. Like, give yourself 6 years before you feel really comfortable. You're going to be questioning yourself for 6 years. And as I'm past that 6 year mark, I feel like, oh, okay, I feel more comfortable in my role, which is really great. Okay, moving on to talk about something that sometimes I think the elephant in the room, but I think good to talk about. So most new grads are afraid of making a mistake. And just in case you didn't know, we're all humans. And so we make mistakes. Mistakes are inevitable. No one's perfect. So I would love for y'all to share with me a time that you made a mistake in your first NP job, and then how did you handle it? I have so many examples. I never made a massive mistake, never hurt a patient. But, there was a time that I severely underdosed a kid who had strep throat that I was prescribing amoxicillin. And the pharmacist called me and was like, hey, do you really want to give this 10-year-old a 1 ml twice a day amoxicillin dose? And I was like, yeah, I don't think I do. And then gave them the right dosing. But it really rattled me and it shook my confidence. And when you're talking to another very trained medical or clinician, healthcare person, it really does kind of rattle you. Like, do I know what I'm talking about? Because I'm being questioned on it. So I'd love for y'all to share if there were any mistakes that you made, and then how did you handle that?
Gosh, I was trying to rack my brain for like a specific example of this, because I know there's been, again, not major, but definitely many, let's see. Well, but yeah, mistakes, and then kind of coming back around to the patient and communicating. And I think the few that I could think of is just like, whether it's maybe prescribing a medication that would have been okay, but like not the best option, or talking through something with a patient, coming out. So my first job was in a fellowship program, so I could come out and talk to other providers and get feedback. So talking through something with a patient and then coming out and then realizing I kind of talked through the wrong thing with the patient and needed to communicate something else. And so in all of those scenarios, I think now how to handle it, or how I've handled it, is just being honest with the patient in a as tactful a way as you can. But I called so many patients my first year, with whether it was either, sometimes I would see the patient, be so honest as to tell them, hey, I'm going to think about this for a moment. I'm going to call you later today. I'm going to talk with some other providers, get some better ideas. But in order to just keep the pace of the day, say, hey, I'm going to call you later. And then in other cases where there was something that needed to be changed as far as their medications go, calling them later that evening. And honestly, I feel like most patients were super, grateful. They felt cared for. They felt that I was being thorough, when in reality I was freaking out. But I think just being honest with patients and communicating, saying I don't know is also okay. And I think can build trust with patients, and that they know that you're going to tell them the truth and try and do what's best for them.
Awesome. I know, Katie, I had an, an antibiotic mishap, and it was a like a child's dose too. But in my defense, like computers, for fun fact, like our Meditech system, I remember I typed it all in right, but sometimes when you type in the dose, it doesn't switch like the weight or something, and I overdosed, like not overdosed, but it was amoxicillin. I gave the max dose of something, and the kid was they could tolerate it, but they got diarrhea from it, and I felt terrible because I didn't double check or check the Meditech error. Um, and that easily can happen to anybody I know, and that literally happened like a month and a half ago. So I've been doing this for 2.5 years. So it can happen to anybody, and it humbles you, and you're like, okay, well, next time, every time I submit an order to go through electronically, I'm going to really double check to make sure it didn't switch back to something that you might have clicked before. um Another example, like I do have pharmacy in the ER with me a lot, so they double check a lot of stuff for me, which is really great, in that sense. So having them as a tool as a new grad and being like, oh, what did I do wrong? Why did you switch this? Or why would you do this medication is super helpful so that you can become independent. And then when you order it yourself, you're like, they're like, oh, Tegan, you didn't ask. You did it right. I'm like, yeah, I did. Like, I'm starting to figure it out. Um, but the last thing I can think of like a mistake was I ordered so the person needed a soft tissue CT of their neck. They were having a lot of like throat pain, esophageal pain, had been on and off for like 2 weeks, not getting any better. They've done chest x-rays. He had a fever, was tachycardic. We're like, okay, well, let's just get a scan of his soft tissue neck, make sure it doesn't have an abscess. Well, I accidentally clicked the one that went soft tissue neck into the chest. So he got like a full all the way down. Was not the right CT. Turned out it was good that I ordered that because we found that they had like an esophageal like tear, which was great to find. But in the sense of like, it's things happen. You might accidentally order something that might be a little bit more extensive. It was the same contrast, it's the same amount of radiation, but just in that sense of you always have to just double check, or don't be afraid to be like, is this the right one you want? Or double checking, even though some doctors might be cranky. Like you just got to do it because it just helps you gain that confidence, or just remember for next time. And I never have ordered that scan wrong since. So
Yeah, I had a patient and we had a really great visit. She was kind of coming frequently to the clinic, and we talked about pain management for her. We discussed a medication. I explained the dosage, explained the side effects. I was super confident prescribing it for her. And then she came back to her follow-up a couple weeks later and was very, very angry because my patient was Muslim and I had prescribed her medication in capsule form. And so I did not know at the time that a lot of the capsules are made with gelatin and they're not all halal. So the patient was very upset with me. The pharmacist had stopped her from taking the medication, thankfully, but she was upset with me that I did not have that knowledge, that I should have known not to prescribe that for her. So that was a moment where I had to really sit with the patient, let her know, like, I did not do this on purpose. I had to apologize. I let her know that, I supported her and I support her religion, and that was not done intentionally. And that's just something that I keep in my clinical pearls. It's one of the things that I'll always remember, and it won't ever happen again. But, we're human, and I'm really grateful for that pharmacist who stepped in and was able to intervene before the patient took that. So there's mistakes that can be made. That was not like a life-threatening decision that I made, but it was, spiritually and morally, that would have been maybe the equivalent to her. So that's something I had to keep in mind.
Yeah, thank y'all for sharing so authentically about some of the mishaps in your first, year, or Tegan, your last couple of weeks. So common. I even did this today. I worked clinically before this, and I'm starting a patient on a biologic in my allergy clinic, and I don't usually do that. I see the follow-ups, and I told the patient come back in 4 weeks, and he was like, well, but the doctor told me to come back in 2 weeks. And I was like, you know what? I don't usually do this. So let me go double check. And sure enough, it was 2 weeks. And so just had to go back and be like, thanks for saying something, because I don't usually do this. If I would have done that, I think in my first year or two of practice, that would have like for me, that would have just like, I'm done. I'm a terrible provider. I should probably not do this anymore. I'm going to go back to be a bedside nurse. But actually like bouncing back from, and that's like a tiny example, but bouncing back from things like that have kind of given me, it's like working out a muscle. It's given me some strength. And just like you said, Morgan, like say sorry, own up to it. Anna, you said that too. Like, yeah, oh my gosh, you're right. I completely misspoke, or I should have double checked that. And then moving forward, Morgan, I love how you said that you use this as a learning tool. Like, okay, this is a pearl in my little tool belt now that I know, especially when I'm taking care of patients that want to avoid pork. I need to not prescribe them capsules. You taught me something. I didn't know that. So you taught me something too.
Same
So
here. I had no idea.
we can all take that away from today. So, all right, moving on a little bit to talk about community. Community is really important when we're making big transitions, and especially this one from RN to NP. I would love to know who you go to for advice or encouragement, and how did you help to build this community that helped you with your transition?
So for me, there's the other NPs and PAs who work in the ER, but I'm the only NP. We have specific hours we're working. So you don't work with any other NPs. You're just working with the doctors. So for me, I didn't really have a lot of NP friends to go to. I mean, a lot of the people that I went to school with were online, so we didn't really know each other. So I went a lot to the doctors. There are a couple that come to mind, some female providers that I went to just kind of to chat with them in regards to their transition in medicine and how that works. And I mean, although they're a doctor, they experience residency, which is probably a similar feeling that we feel when we get out of into the workforce of like, oh, okay, I've got all this education. Now I have to apply it and do it with confidence. And so they honestly are what helped me the most. And that's why I kind of mentioned before, like the people who train you, who you mentor with, they were a big reason that I am successful. Simply because I felt comfortable saying, honestly, I don't know what to do. Like, I was like, there's a lot going on in this room and I don't know really where to start. Or, sometimes you come out of a room and you think you're going to do this and they remember that zebra in the back of their mind and they're like, well, you have to think about this. And I'm like, oh my gosh, when am I going to get there to remember all that? And one of the providers in the ER said that what helped him was each time he left a shift, there's something he didn't know, or haven't heard of in a while. He took like 3 things from his shift and like looked them up and just reviewed it, simply because it just kind of helped him stay on top of knowledge. But also, if he hadn't heard it before, he got to learn something new. And that's something that I really kind of took home and really used, and I still use. If I see something at work, I'll bring it home and look it up later. So I think your circle, your community, the people who you work with, family, friends. I mean, especially if friends that are previous NPs or people in the medical field, they can all relate and understand and support you. So I think having that type of community around you will help you be successful no matter what.
Yeah, I love Tegan the advice about taking those 3 things you didn't learn your shift home, because we're all going to run into something new every day, and that's okay. But then we can go home and have the time to review it. Sometimes the day gets hectic and that has to be on the back burner, and then you have that time to kind of go home and settle down and review that. So I love that. So I really have developed kind of a bigger community as my time as an NP has gone on. I've, recognized the benefits of, healthcare being a team approach. So I do have my friends from nurse practitioner school that I will reach out to still. I mean, we all have different approaches to care, and I may think a treatment plan is great, and some people have other ideas. Also support, if you have a really hard day on your shift, just calling your friends for support and just getting just those words of positive encouragement. I am in a company right now where the Houston branch is mostly physician assistants. And so it's a whole wealth of knowledge from them that I'm learning from. They've been providers for longer than I have, and they make me feel not only valued for what I'm bringing to the team, but they are ones that I never asked a stupid question. So even if I think, oh, this is basic or this is dumb, they've been doing this longer than I have. And that anything I ask is not going to be a dumb question to them. And my collaborating physician's great right now. I can text her, call her, and she'll immediately respond. And just she goes past the point of, this is what I would do, what I would do, but this is why I would do it. So that helps me too in my thought process. It's not just I'm taking an order from her of what she would like for this patient. This is my reasoning behind it. So I think it's really easy to get caught up sometimes in thinking like you're alone on this little island when you first start out, but it's really important to build those relationships, not only to have this, this source of information that you may be lacking, but the support, the emotional, mental support that they can provide for you, because we may be going through the same things, and it's kind of really beneficial to be able to, talk things out.
Yeah, that's really good, Morgan. I would agree. I also wrote down the 3 things you don't know. I'm going to take that into my practice as well. I've been very fortunate, I think, in all of my work settings to kind of have mentor type people built in. So the fellowship program, we were assigned a mentor. We had faculty as resources. I still keep in touch with the other 4 providers that were in my cohort. We text each other about questions and things like that. My current job, I have kind of, again, another physician actually who's kind of considered a mentor role in my job. And so I've been very fortunate to have those things built in, but I would also say if you don't have those, again, like Morgan and Tina were saying, you can have those conversations with your coworkers. I remember before I started NP school, just having a conversation with a friend who was a few steps ahead of me and just saying, hey, would you be willing to kind of come alongside me in this process? And there's still someone I reach out to. And and so I would say have the conversations. And I do think, I think from, I don't know if we all experience this as nurses, but I think when we start out as nurses, maybe we don't always feel like we have the most support, depending on which environment you are in. And I think I've been encouraged just that, more as I've stepped into the provider role, that people are very willing and open to come alongside you and answer your questions and give advice and things like that. So
it's always good to have that network of people that you can call after a shift. For me, it's my identical twin. She and I were both working in the ER, and I'd give her a call. She's a PA, and I would call her after a shift, and I would just kind of unload. Here's what happens. Did I screw up? Did I not? And she just kind of gave me that, like, no, you're doing great. You're good and a safe nurse practitioner. And that she really got me through my first job, which was in the ER. And I'm really thankful that I had her to kind of hold my hand when I would be real anxious after a shift. It always hits you after a shift, right? When you're sitting there driving home or you're laying in bed and you're like, did I do that right? And so she was there to help me with that for sure. Okay, we are close to our Q&A time. So if you're a guest on our call and you have some questions, then pull up that Q&A box and type in your questions. And for our panelists, I'm gonna ask you one more question that I didn't prep you for, so I apologize. But y'all all mentioned sort of a working relationship with either a supervising or collaborating physician, depending on what state you're in, and then maybe some other advanced practice providers, either NPs or PAs. How did you develop a good working relationship with them? So like, how did you develop a good relationship with your collaborating physicians or the APPs that you work with? Just tell us about how you sort of forged that relationship with them. And any of you can start at any time.
Well, I can go. So in South Dakota, for instance, once you graduate NP school, you have 1,041 hours of collaboration that you do with a MD or a previous NP. So essentially for me, being in the ER, it was just pretty much my main supervisor who signed his name on my contract for that. So I really didn't have it wasn't like this big, I always had to go to him for everything. He just kind of reviewed all my stuff. And essentially my collaborators were all the other doctors I worked with. So I don't know if anybody else will ever experience that, but if you're working with multiple providers or you're just with your collaborative provider, I guess my big thing is for me, I kind of found individuals that I worked with the most. And I would go to them and kind of be like, hey, how am I doing? Because in the ER, I mean, for instance, I got thrown to the wolves. I essentially had 1 week where I was an extra, just popping into rooms, and then I got thrown on the schedules. And then the ER is just kind of a place where they just like, no news is good news. So if you're not getting pulled in the office, that means you're not doing bad. And I am a person who likes feedback. So I had to, it was uncomfortable for me, but I'd be like, how am I doing? Like, am I doing a good job? Am I bringing the team down? And I think when you go to whoever you are talking with or you're collaborating with and be like, hey, I know I don't know everything. And sometimes it's hard for me to ask, and I want to be able to ask questions. And I just ask, that you be honest with me, and that, when we have time or we review everything, I want, your honest opinion on how I'm doing, because I want to be successful. And so I think up front, like having those conversations and having that as like a big, I don't know, straightforward conversation right away will help you be successful wherever you are. And know that not all personalities get along, and that's okay. It also might not just be the job for you either. So, I mean, I've had many people who've gone through NP school, and they say the first NP job you get, sometimes people, majority of the time, don't like. And that's okay, because you're trying to figure out what your new niche is. So I guess that's my little tip with the collaboration part of it.
That's good. I don't know if I have much to add. My first job was in a fellowship program, and it was in Colorado. And so there was not a supervising physician. It was all a completely NP run clinic. Again, I had faculty that I built relationships with, that I would go to. I love asking for feedback, like being open to feedback and communicating that you want feedback, I think is huge. And then my current setting is I have a supervising physician, but how I built she was actually one of my preceptors as well. So we kind of had a standing relationship. And then in practice, so she's not in the clinic most of the time. And so usually I'm collaborating either over the phone with other providers or with another provider in clinic. But yeah, I think asking for feedback to the best of your ability, helping build a culture where questions and things are okay. Sometimes that's not up to you in your first job, but looking for that and maybe asking for that as you're considering your first job of, hey, what is the work culture like? And is it okay to ask questions and that kind of thing, I think are important.
Yeah, I had a pretty unique relationship with my first collaborating physician too. So I did most of my clinical hours at the site that I had my first job at. And so we already had that underlying trust and that level of respect that we had established. And I kind of knew how she wanted her go-to treatment plans, how she wanted to establish plans of care for a lot of these patients. So really it was just communication was our biggest thing going forth, how to make that relationship as strong as it could be. So I was there Monday through Friday. She was there Wednesday through Friday or Thursday through Friday. So those days that she wasn't there, we would have to have that communication line established in order for care to be continuous and smooth, even with her absence of the clinic. So that's mainly it. It's just I think communication is really, really strong, which I think you guys can both touched on when you have your collaborating physician.
Thank you all for answering that question that I didn't prepare you for. We have a couple of questions in our Q&A, so thank you all, people that are viewing, for asking questions. I'm gonna say the first question, and this really sort of the TLDR of this question is, how do you kind of go about prescribing? But I'll read the question. Okay, so this person said, one of my worst fears is all of the many medications that people take. And how do you know if something you're going to prescribe is contraindicated with the med that person is already on? I see some patients in my clinicals on 10 medications, And this is such a fear of mine that I will prescribe something that could have a detrimental effect on them because of a medication they're already on. So how have y'all handled that in your careers as NPs?
Yeah, I can answer this one. So I was very fortunate. My EMR that I used actually had an area where it showed contraindications, whether it was mild, moderate, or severe interaction with it. My EMR I'm using now does not, but what I do have is Hippocrates. And so I find it really beneficial. It'll have the medication name, it'll have the side effects for it. And then there's actually a way that you can put in all the patient's medications um, on a list, and it'll show any interactions with that. It also has an area where you can add supplements they're taking as well. So that's kind of my second guess, or I guess double check for whether anything is interacting. So that's kind of what I've found useful in practice.
I know when I first started, that was a big fear of mine as well. It's like, how am I going to know that on all these 10 medications that this other medication is going to be a big interaction? And I will say, through time, when you're used to seeing medications, because whether you're in whatever clinic that you're in or facility, you're going to develop a routine and you're going to see these medications more and more and more. So to just kind of give you some reassurance, like in time, it'll just click. Like you'll look at that and be like, okay, yep, they can't be on this one. Or like for me, a big one in the ER, like for antibiotics, we don't like to give antibiotics a lot. Obviously, we try to be, a little bit more cautious with that. But like, for instance, like giving Levaquin to somebody over age 65, like you can cause those detrimental, like those muscle skeletal thing. I can't think of the word right now, but I just know, okay, bad. And you have your own little routine that you remember with certain medications. And then you get comfortable. Like as you start prescribing certain meds, people are gonna be like, oh, that worked so great. Thank you for putting me on that. Or I'll be like, well, how did you feel when you were on that medicine? Because then when I come around again and somebody might be considering that medication, I'd be like, well, I've had patients on this and they've been successful. Do you want to try that? It doesn't interact with this, and this. So I don't know if that's helpful, but I just want to say, like, over time, it'll definitely click, and it's okay. You're not going to know every medication all the time. Like, it's impossible. There's so many, and medicine changes so much.
Yeah, I don't know if I have anything to add. I think, yeah, use your resources. Good, healthy fear, maybe. Like it is good, it means you care, and you want to be provide good care. But yeah, what Tegan said, you do start to see just common medications people are on. You get used to what you're prescribing, and then it becomes less and less of like, okay, I need to throw all of these medications into UpToDate or into Hippocrates and figure out exactly. But yeah, I would say healthy fear, it does get better. And you'd be amazed at how much you can take all together.
Yeah, that's great. I think this is also a plug for a pharmacist, whether it's in the clinic you work with, or Tegan, I know you work with a pharmacist in your emergency department, or the community pharmacist. If you're prescribing to a specific pharmacy and, calling them and asking if some of these EMRs, like every medication interacts with everything. And it's like, I can't prescribe anything, right? And so it's like, what is the serious interaction that I need to know about so I can be safe and my patient can be safe? And what is it? Oh, we just need to monitor this, or this might be not as effective, those kind of things. So again, just echoing time, lots of experience, and you're not alone. It's a fear that a lot, I think any nurse practitioner that really cares about patients is going to be like, okay, I need to be diligent about this. Moving on, I know that Anna, you can help to answer this question, but Tegan and Morgan, feel free to jump in too. What do you think about the use of fellowships or residency programs?
Yes, big fan. I know, I would say not necessarily, definitely not a requirement, but I think for me, it was hugely beneficial. I did a primary care fellowship in Colorado Springs and just really appreciated the additional support and mentorship throughout your first year as a provider. As we've all talked about, it is like drinking from a fire hose that first, really through nursing school or through nurse practitioner school, and then coming out and starting as a provider. And so with the fellowship, what mine looked like at least is you started off having kind of still like that preceptor clinical type experience for like the first I think it's like 6 to 8 weeks. And then you slowly started becoming more independent. And then we also had didactics and lectures from specialists um, one morning of a week. So you kind of just continue to like deepen the foundation of your knowledge base that you've gained throughout nurse practitioner school. And then we also got some like specialty rotation. So I know with clinicals in nurse practitioner school, just depending on where you are, they can be difficult to find and get in with the specialist that you need, whether that's peds or women's. And so we got more time in those areas, and that was hugely beneficial for me. So I highly recommend it. I definitely don't think you have to. You can be successful as a nurse practitioner without it. But if you can find one that looks like it is something that you're interested in, I think it's a great way to kind of deepen your foundation and grow as an NP.
I love that. Sometimes I wish I would have did one. Just I heard there's a girl that who used to work in the ER, and she left and did I think an ER fellowship. She went to family medicine or family nurse practitioner, and she absolutely loved it because in family nurse practitioner school, you don't learn the like critical care part. Like you just know when to send, when to send, when to send, when to send. And so she loved it because she got the further education on like intubation and ventilation and things like that. And that's not just for ER. I mean, I think of, gosh, if I wouldn't have been in the ER where I am now, I think I would have loved a fellowship program because I think that extra time to slowly transition, I think I would have loved the feedback because I'm a constant like reassurance person, like you're doing great, you're doing good. And I think a lot of us probably are like that. And so I can see the total benefit of doing one of those 100%.
Yeah, I agree. I did not get the opportunity to have a fellowship, but I think there are a lot of really great benefits for it, a lot of great mentorship opportunities. I think that's kind of a little bit of a confidence booster too when you're going through a program that's kind of giving you kind of like more support as you go through the first transitionary period between being a student and that nurse practitioner role.
Yeah, great insight. Thanks, guys. I think there's also some new job sort of program. So if you're working for a big health system, similar to when you started as an RN, some of them have kind of more of a structured onboarding process that might function sort of like a residency. So I would encourage anyone, that's trying to find that new job as their first job as an NP, just to really, if you can't get into a residency or fellowship and you really want that support, try to find a job that will really be supportive as you're making that transition, that making the shift from RN to NP, like really helps to set up some good support systems for you and lets you kind of make it slowly rather than Tegan. I had a very similar experience to you. Like I showed up and here are my patients in the ER. I'm like, okay, great. So, okay, next question. Are there any insights for new grad nurse practitioners who are seeking their first position? So what advice would you give to somebody that's looking for their first job?
Gosh, I mean, for me, when I went to apply at the last portion of school, they're like, okay, 6 months before you graduate, you need to put your application out there, you need to apply. And I was doing that and I got no calls back. And I'm like, oh my gosh, I'm not going to get a job. For instance, in Sioux Falls, it's a very saturated market here. So they really didn't look at you unless you took your boards and passed. That's just the reality here. So wherever you are, don't feel discouraged if you're trying to apply before school ends and you don't get an interview back right away. For me, a big thing I knew when I became an NP is I did not want to be a scribe. I did not want to go in the room with the doctor, stand there in the corner and just type for him. That's not like and people love that. Like I love that for you. But for me, I was like, I want to use my skills. I want to use these interventions. I want to use like my critical thinking. And so when you do interview, making say, what is my role? Am I going to be just typing? Am I going to be having patients? Like, am I going to have my own patient load? Another question you can ask is, how is the culture within the department? Are there a lot of other NPs or PAs? How are they feeling? What are you expecting from me? And when you ask those questions in your interview, you kind of figure out, well, do I really vibe with these people? Like, do you think I'll be happy? And just really finding out what's important to you in your practice and seeing if that matches up and not being afraid to ask. Because I know you just want to get the job. And sometimes that's how life works, but also don't be afraid to be a little picky and ask those little bit harder questions to figure out if it's the right fit for you.
Yeah, I totally agree with Tegan about it's so important to ask questions in your interview. Don't just take the first contract they give you at face value, and don't feel like you have to take the first job offer either. It's really important to get a list of what's expected out of you. Is there gonna be a transitionary period? Or is there gonna be training involved? Or is it gonna be like, you show up for the first day and it's go time? You really want to make sure that you know what you're kind of stepping into for your first NP role and not get blindsided. Are you expected to work weekends on call? Are you going to be the only provider there? Who else is there? Do they how are they liking their job there? I mean, there's different things that you need to investigate for your first job, because I think that first job is really important. It doesn't have to be the dream job, right? It doesn't have to be where you stay forever, but that kind of makes a bit of a lasting impact. That's where you're starting to take what you've garnered from your grad program and you're now implementing into the real world. And so it needs to be a supportive environment. It needs to provide foundation for your practice to grow and for you to continue to love it. Because if you pick the wrong job, you can lose your passion a little bit for what you do. So that'd probably just be my advice. Just be inquisitive, and just be an advocate for yourself too. Like, you are worthy of getting a great job.
That's good. Yeah. And I'll speak to the, I guess, fellowship. If you're considering a fellowship, I would say let go of your timeline unless you're considering a fellowship. Don't rush into anything else. But if you are considering a fellowship, maybe start looking around 6 months before you graduate, just to get an idea of when timelines for applications are and things like that. Just because there are those deadlines. But with that being said, because I did a fellowship, like I said, I graduated in December of 2021 and did not start again until September of 2022. And so, again, I think we sometimes have this sense of urgency that we need to go, or we're going to forget things. Like, just, if there's a gap, take a breather. It's okay. You don't have to rush into the role, and you do want to be mindful about what you're stepping into. With that being said, if you do end up in a role that is like Tegan mentioned, not your thing, then it is there's freedom to step out of that as well. So
wonderful. Well, that's all the questions that we have. I did want to ask one last question quickly. Morgan, you mentioned contracts and things, and maybe negotiating. Did y'all negotiate your first contract? Were there things that you asked for? I know for mine, it was kind of like you get what you get and you don't throw a fit kind of conversation. I worked for kind of a big physician staffing or provider staffing group. And so there really was no negotiation. But for those that may have some negotiating room, how did you approach that?
I actually did not negotiate, and that's something that I kind of look back on and regret a little bit. So don't be afraid to take that, contract or the offer home and kind of figure out, is this what I really want? Or kind of bring back to the table, these are actually, can we meet somewhere in the middle? Like, where's the compromise of where we can come in the middle for this? This is what I would like to include in my contract. So that's something that, going forward for my last contract I signed, I definitely took at least a day to kind of look it over and be mindful of what it included. Is there anything, does I need anybody else to look it over? I think I needed like a lawyer to look it over. It was a very, basic contract, but I definitely took the time to really read every line to make sure I knew what was expected out of me for that position.
I was similar to you.
Mine was Tegan. Did either of you negotiate?
Sorry, I did not negotiate. It was good to get don't throw a fit. I remember I asked for a little more and they're like, well, this sounds terrible. They essentially were like, there's more supply than demand. So, and I was like, oh, okay. Cause I'd been in the same hospital for up to 5 years already. I was like, is there any way I can move up on the ladder? Like, I've stayed here, nothing. But I mean, you never know until you ask. I mean, I guess I think of one thing, one of my friends, she moved, and when she applied for her new job, she's like, well, do you have any reallocation assistance, which is something I didn't even think about. And they ended up like, yeah, here's $1,000 for moving. I'm like, that's great. So I guess you never know until you ask. And so, and not asking is very, money is a weird conversation for me. I do not like asking. It's hard for me to be like, oh, you didn't pay me my money back, I'm just going to let you not pay me back, 'cause I don't like to talk about it. So I totally get the awkwardness with it. But the big thing is as NPs, and I bet a lot of NPs feel this way, is, you know your worth. And if you are doing a lot of work, don't be afraid to ask for more compensation, because I think it's similar to like a EMT nurse role. Like, sometimes you see the EMTs don't get paid as much as the nurses, but they're expected to use just as much. So just don't be afraid, like she said, to advocate for yourself, know your worth, and take it home and look over it a day. You don't have to sign the dotted line right away.
Yeah, I also did not negotiate. But fellowship was kind of like, oh, you accepted me in the fellowship. But and then my current job is also very different, nonprofit, high trust situation. But I would say ask lots of questions. I have had friends who have negotiated their contracts and successfully, and gotten increases and things like that. And then I know Baylor, so depending on where you're at in school, ask your faculty too. They may have someone who can like look over contracts as well. That could be helpful as well. So
another plug for community, another plug for getting some people that have some experience around you to help you. Well, Anna, Tegan, and Morgan, thank you so much for spending some time with us today and just really sharing authentically about your transition from RN to NP. And for those of you that are joining us online, I really, really do appreciate you coming. Thank you so much. We would really love to connect with you. We love to interact with future nurse practitioners and new nurse practitioners. So you can email us. We have an email address. It's np@hippoeducation.com. And you can visit our website. It's home.hippoed.com/making-the-shift. And you can find some of the resources that we have available to help you to make this transition smoothly and really to help you to be the best nurse practitioner you can be. It is our honor to help walk through this transition with you. So thank you all for being here today.
Thank you.
thanks for having us, Katie.
This is Hippo Education.